jack it up.
Hello guys, welcome back to our next video. In this video we will be talking about fever. So what is fever? Fever is the temporary increase within the body temperature. So as we all know, the normal body temperature of an individual, especially for an adult, is 37 degrees in Celsius and 98.6 degrees in Fahrenheit. Now, when the body temperature increases to 38 degrees in Celsius and 104 in Fahrenheit, we refer to it as fever. So, but what causes the body temperature to increase is what is the cause of fever. When the individual has an infection, it is the beginning of pyrogens, that is, the generations of heat, because the word pyro means heat and gens mean beginning. So when an individual has an infection like bacteria, fungus, and other parasites as well, it is going to affect directly the hypothalamus. And the hypothalamus, it is a part of the brain that is right below the brain that is responsible for body temperature regulations, either by increasing the body temperature or by decreasing the body temperature. So when the body or when an individual have an infection, it is detected by the immune system, which is a white blood cell. And the white blood cell is manufactured within the bone marrow. So the white blood cell is going to release the cytokines. It's going to release the cytokines. In releasing the cytokines, to either decrease, to either kill or inhibit the bacteria or fungus. To properly understand what is happening when an individual has a fever, we take a look at this graph. Here is the body temperature, and here we are having the time. Now, this when the hypothalamus is below the body temperature here, there is no increase or decrease within the body temperature. Means that it is normal. But so in blue here we say is the body temperature. So we say body temperature so that we cannot forget. So here we say this is the body temperature so that we cannot forget. So when the set point of the hypothalamus increases, this is the hypothalamus. So when the set point of the hypothalamus increases, what happens? The body temperature also increases. the body temperature will also increase because the hypothalamus is responsible for the regulations of the body temperature. If the hypothalamus decreases, therefore the body temperature is going to decrease. So here what happens is, when the set point of the hypothalamus is increasing, the body temperature here is going to increase. Now, at certain point, the hypothalamus and the body temperature will be at the point of equilibrium on the same side, where there is no increase within the hypothalamus set point and there is no increase in the body temperature. Now, when the body or the immune system kill or inhibit the growth of the bacteria, the hypothalamus no longer increase, but what happens? The hypothalamus begins to decrease. The hypothalamus begins to decrease and coming back to the set point. So the hypothalamus here is going to decrease to come back to normal. When the hypothalamus is decreasing, therefore, the body temperature will also decrease and come back to normal. But what happened at these various points? At this point, the set point of the hypothalamus is increasing, so the body is trying to hit the temperature is increasing, so the body is trying to hit the hypothalamus. So here you have chill, or call it Ramsor. So you begins to chill at this point. But at the point where the hypothalamus and the body temperature is same, so here there is no heat and there is no cold. Your body temperature is going to be what? At normal. And at this point is called the crisis point. We call this point the crisis point. It's the point at which the body is going to detect that there is no infection or bacteria or viruses. So the hypothalamus begins to decrease and the body temperature will also decrease. But the body temperature is higher than the hypothalamus here. So the body temperature will try to cool, the temperature will try to cool the body temperature, so there will be a heat generation. You start feeling heat here. So at this point, when the fever is coming down, or the set point of the hypothalamus is coming down, along or in accordance with the body temperature, there will be a heat generation. You begin to feel heat. But at this point where the set points of the hypothalamus is high and the body temperature is also increasing, it will try to cool down the body temperature, so you begin to chill. You start getting cold. So when an individual has been diagnosed with fever, it is advisory that he or she cannot take medication for 2 to 3 days. Why? Because increasing the body temperature or generations of heat is the normal way for the immune system to fight against viruses. So within the course of 2 to 3 days, when an individual has been diagnosed with fever, if you take any medication, what is going to happen? You are going to be suppressing the immune system from functioning. So therefore, in this time, you cannot take medication. But after 2 to 3 days, we call it prolonged fever. Now means that there should be a variety of infection or bacteria or virus. So the doctor is going to prescribe a medication so that the fever can be breaking down after this period of time. When an individual have a fever, after the prolonged period, you can go for this medication. But these drugs are called OTC drugs. So what is OTC? It's over-the-counter drugs. So over-the-counter drugs, these are drugs that is administered to the patients without prescriptions, without no physician prescriptions, without doctor telling you do this and do that. But these drugs are safe when you follow the instruction. Now, like paracetamol. Paracetamol is administered to break down the fever. But how the paracetamol is going to work? It's going to act on the hypothalamus. It's going to act on this hypothalamus to reduce the fever or to reduce the body temperature. Or to reduce the body temperature. So this, when you administer the paracetamol to the patient, this paracetamol is going to act on this hypothalamus to reduce the body temperature. So in this video, we've been talking about fever. Say, what is fever? Where we say it's a temporary increase in the body temperature. And we've been talking about the normal body temperature, 37 degrees Celsius, and 98.6 in Fahrenheit. And we've been talking about the hypothalamus. We've been talking about generations of heat, and we're also talking about the immune system, how the immune system works to kill or to inhibit the growth of the bacteria. Thank you so much for watching. If you like the video, please subscribe and share, comment. Thank you.
Jack it up.